SIU is the place to be, in my opinion, because we have the systems, the history, and the track record of teaching and preparing the next generation of clinicians. The SIU Endocrine program is the central program for training endocrine fellows for the state. Its mission plan dovetails into that for the SIU School of Medicine as a whole. Education, teaching, and training is the primary goal.
We have a four-person fellowship. Our program is a 2-year clinical track program. Through the years, we put together an outstanding fellowship that prepares people well for careers in clinical practice, or if they prefer an academic medicine track, careers as clinician educators or clinician researchers. We are downstate Illinois' only academic medical center, and that means that we have a large catchment area, and that's an aggregate population of approximately 2 million people. Because we're the only academic medical center downstate, we don't compete with other programs for patients who have complicated or unusual cases.
So we have a great opportunity here to see different routine endocrine cases as well as rare endocrine cases around the area. Not only from Springfield, but also from the southern and central part of Illinois. We learn how to do diabetes management, thyroid management, pituitary cases, adrenal cases. They teach us how to read DEXA scan and also the new devices coming in for diabetes. The strength about this program is that it's like a small program, so we have direct interaction with our faculty members. So it's basically one-to-one interaction with our faculty member. So the amount of attention we get from the small program is really uncomparable.
We are smaller than many of our comparable programs that support four-person fellowships. However, this gives our trainees the opportunity to work with everybody in the division over the course of their 2 years of training, and also have significant and highly meaningful interactions.
Here within the school, the degree of diversity is really remarkable. This is like the United Nations. You have people from all over the world here. From an educational perspective, it broadens perspectives of our trainees. They get to really understand what it means to work with people who have very different perspectives, and that enriches everyone, I feel.
I think we have a very supportive culture. We have high expectations for our trainees, but I think we train them in an environment that is friendly and transparent and clearly supportive.
Culture here is very friendly. Here is like a second home for us. We are here for each other, for our success, and also if we are going for a difficult time, we are always there for each other.
Why would you want to come to SIU as opposed to the many excellent programs all over the country? And I've been to a few. The community is by far, I think, the greatest draw. Springfield is a jewel in the heartland of the country. People come here and they don't leave.
I think Springfield is a really nice place to live. It has festivals during the warm weather. It has great restaurants, and it's basically you're living in a city, but it's less cost of living and it's more peaceful. They have good universities here, especially for the families, and good education.
I think somebody who comes to SIU for fellowship, I think you get both a depth and breadth of training. I think we prepare people to do well once they leave our institution.
For a fellow who wants to go through fellowship and come out being thoroughly prepared as a clinician, being thoroughly skilled as an educator, and also having the capacity thereafter to do other things if they so choose, SIU is the place to be, in my opinion.